A bit like John Ashton, I need to say I'm talking in a personal capacity. I've worked in public health since 1973. We're the medical specialty, in case you don't know us, that deals with health policy. So we're the specialty that understands the health bill best. As both a public health doctor and a diabetic with multi-system health problems, I'm absolutely clear that if this bill is passed, it will cause avoidable suffering and deaths on a large scale. You may have heard on the radio this morning that amputations among diabetics are much higher in some areas than others, and that multidisciplinary care is needed. And of course, everything in the bill goes against multidisciplinary care and collaboration. In my view, we're in a war situation. The government has declared war on universal welfare state services and wants to change the NHS from an equitable system shared by all of us into a poor-quality public safety net and an insurance-driven private market for those like themselves who can afford it. They don't, of course, admit to that in public, but policy analysts and lawyers who have studied the bill in detail are absolutely clear that this is true. It's also spelt out, interestingly, in books like Oliver Letwin's Privatising the World, that this is the Conservative vision of the welfare state. Read it. It's a shocker. If the bill is passed, NHS will, as someone said earlier, just be a logo, a budget and a few quangos. It's already clear that the Department of Health should be renamed the Whitehall branch of McKinsey & Co. I'm having to rush, so I'll just end with two messages. The first is to Lib Dem and crossbench peers. It's a quote from Mahatma Gandhi. Non-cooperation with evil is as much a duty as is cooperation with good. And the second is from somebody who I would absolutely love to have seen here tonight, the late, great Claire Rayner, OBE, nurse, writer and agony aunt. And she said, as some of you will know, tell David Cameron that if he screws up my beloved NHS, I'll come back and haunt him. Thank you.